We have a lot of patients that come to us from abroad that had previous MRIs that were reported normal, despite of the symptoms very suggestive for endometriosis or adenomyosis. When they get to our center, we perform a new MRI, and many times we have a lot of surprises. Relevant to that idea, we have the case of a patient with the previous MRI and previous surgery. The patient was symptomatic. The MRI that we performed reveals signs of adenomyosis. We can see that the uterus is bulky, and we find these cystic areas inside the myometrium, which are very suggestive for adenomyosis. Also, there is a large endometriosis nodule on the posterior wall of the uterus, in the area where the uterosacral ligaments connect to the uterus, also extended behind the cervix, and with adhesion to the anterior wall of the rectosigmoid junction. In this area of adhesion, we find a nodule inside the bowel wall with a cystic component, a nodule that also affects the muscular layer of the bowel wall. Besides those findings, also the patient had uterosacral ligaments involvement, parametrial involvement, more important on the right side, and a very low positioned cecum in the pelvis with adhesions to the endometriosis area in the right parametrium. At the level where the cecum is adherent to the right parametrium, we also found a nodule of endometriosis on the posterior and inferior wall of the cecum. All the lesions were confirmed during the surgery performed later by our surgical team.